Hello everyone, my name is Ifatu Pearl Obasi and this is a collaboration and leadership reflective video. In this video, I plan to reflect on an interdisciplinary collaboration experience, noting ways in which it was successful and unsuccessful in achieving desired outcomes. I will also identify how poor collaboration can result in inefficient management of human and financial resources. I would also identify best practices for leadership strategies from the literature that would improve interdisciplinary teams' ability to achieve its goals. All of this will be done with professional communication and conduct and giving credit to scholars of literature through proper citation. The interdisciplinary collaborative project I will be reflecting on is one that occurred during my place of work, and it involves a patient who had a diabetic foot ulcer. The names of the patient and healthcare team members would be changed for HIPAA purposes. As a home health visit nurse, one main criterion of my job is to provide a comprehensive assessment of a patient's health, ensure proper medication administration and adherence, provide adequate teaching to patients and family members present, and also be a point of contact in addressing any specific situation going on with the patient. In this case, a diabetic foot ulcer, measuring about 6 cm by 3.5 cm by 0.5 cm in dimension. My main goal in this situation was to make sure that the wound care heals well within its limitations, that is, having a better appearance free from foul exudates, smaller dimension during wound care, and overall improved sense of wound healing. To achieve this goal, I had to work with the wound care doctor, Johnson, the pharmacist, Melinda, and the wound care supply team, Edgepark. All these people comprise the interdisciplinary team that I worked with to ensure patient goals were being met in a timely and effective manner. According to Pick Grayson and Campbell Udobi, lack of communication among healthcare providers of varying disciplines, although often not purposeful, can lead to a negative impact on interdisciplinary teamwork, while effective communication has been linked to improve employee satisfaction, enhanced patient care, and reduced healthcare costs. The collaborative experience with the team was insightful yet very challenging. One of the few challenges that was faced during this process was the issue of communication, and not just communication as an act, but communication in a timely and effective manner. Dr. Johnson had ordered a saline moistened wound dressing with the application of Santyl ointment to the wound bed. The wound care order had been adhered to up until the time when the Santyl ointment was finished. As a nurse, I had assessed the ointment and anticipated that it would probably be enough for about 6 more days of treatment to go on ahead, and then I informed the pharmacist, Melinda, of the need for a refill order. This communication went very well, and Melinda told me that the ointment would be shipped to the patient's home within 2 to 3 business days so that the patient's wound care would not be obstructed. However, this was not so. Melinda had forgotten to check with the insurance company regarding the patient's medication, so the Santyl ointment delivery was not approved, which caused the patient's wound care to be compromised, as the patient was out of wound care for about 6 more days. This part of the collaboration showed a great limitation and weakness in how poor collaboration and communication can greatly affect care. According to Nyberg and Henberg, a lack of collaborative skills between professions or occupational groups can result in negative consequences. In this case, prolonged patient care. For teamwork to be effective, various requirements must be present, one of which is communication. But despite the challenges that my team had with communication, teamwork, and constructive criticism, without made the overall therapy period a success. Teamwork is important because it helps foster a common goal and outcome of patients' conditions by ensuring that the right care is being adhered to. Poor interdisciplinary collaboration not only affects the patient's time of recovery, but it also prolongs the cost and causes a financial burden to the healthcare system. This is because when there is no effective collaboration through teamwork and communication, patient care tends to be prolonged, which in turn would extend the time and care that the healthcare professionals would spend with the patient. Like in my scenario, a therapy that would have taken about 4 weeks ended up taking about 8 weeks to be completed. And this is because during the process of collaboration, there was miscommunication and patient care was obstructed at some point. Thank you.